Hello, and welcome to a quick overview of over-the-counter eye drops. This guide was created by student pharmacists at the UNC Eshelman School of Pharmacy to help patients use these medications on their own. To begin, let's look at the impact of this topic. Studies show 40% of the US population uses at least one non-prescription medication in any 48-hour period, and about 117 million Americans used eye drop products in 2020 alone. While these products are convenient, there's still lots to learn to use them safely and effectively. Have you ever wondered, is there any difference between branded generic products? How will I know if a medication is working? How can I tell the difference between an eye drop or an ear drop? Learning the basics of your over the counter medication can help you feel better, prevent side effects, and stay safe. Of course, your local pharmacist or other healthcare provider are always great resources for information too. Eye drops are used to treat dry eyes, which occurs when tears don't provide enough lubrication to the eye. This can cause inflammation and damage to the surface of the eye. Eye drops can also be called artificial tears, and they're used to keep moisture on the outer surface of your eyes and lubricate the eyes. There are many products available over the counter that are eye drops, but you might have to try multiple kinds to see what works best for you. One important consideration is if you want to use an eye drop with or without preservatives. As we said before, eye drops are effective in treating dry eyes. This can have many causes, like aging or even certain medications, like antidepressants, sleeping medications, decongestants, or antihistamines. It can also be caused by medical conditions like thyroid disorders, arthritis, lupus, or allergies. Some signs that you may have dry eyes are scratchiness, burning, irritation and redness, blurred vision, or sensitivity to light.
You should not use eye drops if you have recently had an eye surgery, if your doctor has not approved of any over the counter eye drops for you to use, if you're experiencing blunt trauma to the eye, or if you have signs and symptoms of an eyelid infection, such as redness or thickened eyelids. Examples of eye drop products include Systane lubricant eye drops, which are artificial tears used to provide long-lasting moisture to dry and irritated eyes. Use 1 to 2 drops as needed for dry eyes. Zaditor antihistamine eye drops relieve itchiness due to allergies. Use 1 drop in the affected eye twice daily, every 8 to 12 hours. Boshinlum aloe histamine eye drops are used for temporary relief of itchy eyes, specifically due to ragweed, pollen, grass, animal hair, and dander. 1 drop in the affected eye should be used twice daily, every 8 to 12 hours. Do not exceed more than twice a day.
Preservatives have many pros and cons. But eye drops with preservatives contain chemicals that decrease bacterial growth after opening. This allows the bottle to be used multiple times, but for people with moderate or severe dry eyes, these chemicals can be irritating. Preservative-free eye drop bottles come in single-use vials and have fewer additives. This could be a better option if you use eye drops more than 4 times a day or if you have severely dry eyes.
So for the steps for administration for eye drops, there's 5 important steps. First, you want to make sure you read the label on the bottle. You want to look at the description to make sure that the medication is for ophthalmic use only. Second, it's important that you wash your hands thoroughly, as it is essential when it comes to touching your eyes. This lowers the risk of hand-eye transmission of germs. Third, you want to open the bottle. When doing so, you want to gently shake the bottle and remove the cap of the bottle. When doing so, make sure that you avoid touching the top of the bottle. Fourth, you want proper positioning. When doing so, you want to remove any contact lenses you may have and tilt your head back slightly and look up. You'll use one hand to pull down your lower eyelid, forming a pocket. Then you'll hold the bottle with your other hand and place it directly in the pocket. Lastly, when applying the eye drops, you want to gently squeeze the bottle to apply the proper amount of eye drops as instructed by your prescriber. You want to close your eyes and avoid blinking. Using your finger, apply pressure to the corner of the eye where it meets your nose for 2 to 3 minutes. Lastly, you'll want to blot any excess solution with a clean tissue prior to opening the eyes. The main 3 side effects of eye drop usage include widened pupils, stinging or redness in the eye, and blurred vision. Due to these effects on your vision, it is important that you don't operate a vehicle or machinery for several minutes after application of the eye drops. If symptoms like eye redness, irritation, or dryness endure despite prolonged use of eye drops, there may be something more serious going on, such as inflammation, an eye infection, eye trauma, or something stuck in the eye, and you should tell your doctor or pharmacist promptly.
If you still have symptoms of dry eyes even after using eye drops for about 2 to 3 days, contact your doctor or ophthalmologist. Also, make sure to seek immediate medical attention if you notice any symptoms of a serious allergic reaction, such as a rash, itching, swelling, especially of the face, tongue, and throat, severe dizziness, or trouble breathing. Some other treatment options would be to avoid any air blowing in your eyes, such as from fans, hair dryers, or car heaters. You can also add moisture to the air, such as using a humidifier. You can also give your eyes a break and take frequent breaks while studying or reading. In addition, make sure to avoid any triggers, such as any allergens or secondhand smoke.
Next, we have a video demonstrating how to instill eye drops.
Wash your hands before putting in your eye drops. Remove the cap to the eye drop medication and do not touch the dropper tip. Tilt your head back slightly. With one hand, pull your lower eyelid away from the eye to form a pocket. You can do this by pulling the lower lid down with your index finger. With your other hand, hold the dropper tip directly over this eyelid pocket. Look up and let the eye drop fall into the pocket without touching the bottle to your eye or eyelid to prevent contamination of the bottle. Close your eyes and do not blink, and apply pressure to the point where the lids meet the nose. Hold for 2 to 3 minutes, or as long as your ophthalmologist prescribes. Before opening your eyes, and this is very important, wipe unabsorbed drops and tears from the closed lids with a tissue. Then open your eyes.
There are quite a few questions that come up when it comes to instilling eye drops. Here are some common ones. First one being, can I use eye drops while I have contacts in? The answer to this is no. Unless your drops specifically state that they're okay to use with contacts, remove your contacts before putting your eye drops in. After giving your eyes a few minutes to absorb the drops, you can go ahead and put your contacts back in. Another common question is, what is the first step to do before getting ready to put my eye drops in? The first step is that it is crucial to first wash your hands thoroughly and wash the areas of your face around your eyes and remove your contact lenses as stated before. What should you do after you put your eye drops in? You'll want to close your eyes and use your finger to apply gentle pressure to the inside corner of your eye for 2 to 3 minutes. Blot any excess solution with a clean tissue before opening your eyes. And lastly, what should you do? When should you follow up with your doctor if there is no improvement? It would be after using over-the-counter eye drops for a few days. If your symptoms still persist, you should contact your doctor on what to do next. Here are some references in case you'd like to follow up on the sources. And thank you so much for listening to our presentation. We hope this was helpful. For any further questions or concerns, please contact your local pharmacist or primary care provider. Thank you.